1 in 3 women will die from heart disease, and oftentimes they didn't even know anything was wrong, which is why Cone Health is putting on a free event for heart health. Women, it's this Friday. It runs from 8 until 1. It is right here in Greensboro, and again, it is free. Caitlin Walker, a nurse practitioner with Cone Health, is with us to give us kind of an inside look at the event. And Caitlin, we just had all the information up, and I know it goes from 8 until 1, but folks are not required to stay there the entire time.
No, so it's a rolling event. You can register beforehand, you can register when you get there, but you can come at any point. So you can drop in anytime, leave anytime. We've made the schedule this year so that you can still, no matter what time you come, you can participate in a variety of different activities. So you don't miss out on anything no matter what time you're there.
Okay, and so it does start at 8, it goes until 1, and like she said, there is a full schedule. So let's put up that full schedule, and Caitlin, kind of walk us through what is available.
Absolutely. So we're starting the morning with, we have a guest speaker from Emory Prevention Cardiology, Dr. Isandiso. She's going to do a really great presentation to start the morning off. And then later in the day, it's all rolling. So we're going to have lectures that repeat themselves, and you can choose your own adventure. So there's a lecture on menopause, there's a lecture on heart rates, there's a lecture on calcium scores, which look for plaque in your heart arteries. There's a lecture on all sorts of different things. There's pharmacy consults, so you can sit down with a pharmacist and go over your medicines or questions you might have, or ask, do I need this medicine? My friend takes it, my sister takes it, do I need that too? And then there's workout classes going all day long, so you can try a couple of different ones. There's Tai Chi, there's yoga, they're gonna be a lot of fun. And then there's also just an expo with community agencies to say, how do I get plugged in to keep my heart healthy? How do I get plugged in to meet other women and build community? So it's just one of those things. There's something for everybody, and we would love to have you, even if you can only be there for 30 minutes. I think there's still something for everyone.
For sure. Okay, now if you can be there a little longer than 30 minutes, there is a whole host of screenings that are offered for free. Before we get to what the screenings are, my question is, do people need to wear something specific, and will their insurance be billed? Do they need to show their card?
So this is a totally free event. So you do not have to bring your insurance for any of the screenings. There's no cost for anything. We suggest wearing something comfortable. For some of the screenings, you might have to pull up a sleeve or have access to one of your legs. So just be comfortable. It is National Go Wear for Red Women Day. So all of those that are volunteering and helping at the event are going to be wearing red. So if you want to join us and wear red, we would love that.
All right, you can fit right in. All right, let's go through some of the screenings and then what they do for us, because some of these screenings we probably have heard of and other screenings we have no idea what they are. So let's start with that first one. It's the ABI. What does that stand for?
So ABI is ankle brachial index, which is a fancy way of saying they're looking for plaque buildup in your legs. We're looking for blockage in the arteries in your legs. So they'll take a blood pressure in your arm, and then they'll take a blood pressure in your leg and compare the blood flow between the two. So that test takes 10 to 15 minutes, but you get results right there. And if you get concerning results, that's where you can go sit down with either one of the nurses, a physician, or a pharmacist to go over those results before you leave.
Okay, the next one on my list is the cholesterol screening, which most of us have heard of, and sometimes we get it and sometimes we don't.
Yeah, so there's two variations of the cholesterol screening that are offered. So one is a finger stick, so that takes seconds. We prick your finger, we get results right there. The other one is a blood test. So that, we draw blood, that takes a couple of minutes. That test will come back not the same day, but one of the Cone Health nurses will call you to go over those results. So that way you know exactly what they are. Cholesterol is so important because it tells us about your risk of having a heart attack or a stroke. And there are so many things we can do to lower cholesterol, from how we eat and how we move to the medicines we take. So we want to make sure we know what those numbers are, because if we don't know what they are, we can't do anything about it. The other screening test they're doing with the blood work is an A1C, which is something that looks for diabetes or pre-diabetes, or if you are diabetic, it tells us how well are those medicines working for you. So the goal is always to get more information, so then we can really make sure we optimize our health with that information.
Okay, and the last one that's on my list is another one that people have heard of, but often do not do it, maybe even more than once a year, if that, and that is the blood pressure.
Yeah. So a blood pressure screening takes 2 or 3 minutes. I would just make sure you have maybe a shirt that you can pull the sleeve up so we can get the most accurate results on your actual arm rather than over top of a heavy sweater or something like that. High blood pressure is nicknamed the silent killer because a lot of people that have high blood pressure don't have any symptoms whatsoever. But what happens is that high pressure over time puts so much stress and strain on your organs and can cause damage over time. So we want to make sure if we have high blood pressure that we're treating it. And also, if you have high blood pressure and you're faithfully taking these medicines every day, we want to make sure that those medicines are working for you and don't need adjusted at all.
Okay, all of these things sound fantastic and what we need to do to take care of ourselves. So, Caitlin, thank you very much. Let's put up the info one more time so that everyone at home can see what we're talking about. Remember, this is Friday, February the 7th. It is from 8 until 1. Again, this is a free event. There are all kinds of free health screenings. There are workshops. There are exercise classes. You can register there on site. Again, Friday, February the 7th. All right, we're going to take a quick break from News of the Day and check in on that forecast.